Headaches are one of the most common health complaints worldwide, affecting people of all ages and backgrounds. While many people experience occasional headaches that are easily treated with over-the-counter medications, others suffer from chronic or recurring headaches that can significantly impact their quality of life. Diagnosing and treating headache disorders can be challenging, as there are many different types of headaches with a range of possible causes and symptoms. However, the use of diagnostic criteria and tools can help healthcare providers make accurate diagnoses and develop effective treatment plans. In this video, we'll explore 10 helpful pieces of information about the use of diagnostic criteria and tools in identifying individuals with headache disorders. From the most widely used diagnostic criteria to the different types of treatment options available, this video will provide a comprehensive overview of the tools and techniques used to diagnose and manage headache disorders. Whether you suffer from occasional headaches or have been diagnosed with a headache disorder, this video will offer valuable insights into the diagnosis and treatment of these common conditions. So sit back, relax, and join us as we explore the world of headache disorders and the tools that healthcare providers use to diagnose and treat them. 1. The most widely used diagnostic criteria for headache disorders are the International Classification of Headache Disorders, ICHD, criteria, which are updated regularly by the International Headache Society, IHS. The International Classification of Headache Disorders, ICHD, criteria is the most widely used and recognized diagnostic tool for headache disorders. It was developed by the International Headache Society, IHS, to provide a standardized classification system for different types of headaches based on specific criteria such as the frequency, duration, and location of headaches, as well as associated symptoms and triggers. The ICHD criteria is regularly updated by the IHS to reflect the latest scientific evidence and clinical practice recommendations. This helps ensure that healthcare providers around the world have access to a reliable and consistent tool for diagnosing and treating headache disorders. 2. The ICHD criteria are designed to classify headache disorders based on specific features, such as the frequency, duration, and location of headaches, as well as associated symptoms and triggers. For example, the criteria differentiate between tension-type headaches, migraines, cluster headaches, and other types of headaches based on their unique features. This helps healthcare providers make accurate diagnoses and develop appropriate treatment plans for their patients. In addition to the ICHD criteria, other diagnostic tools such as imaging studies and neurological exams may also be used to help diagnose headache disorders and rule out other underlying medical conditions. 3. The IHS has also developed a range of tools to aid in the diagnosis of headache disorders, including questionnaires and headache diaries that can help patients track the frequency and severity of their headaches. These tools include questionnaires and headache diaries that can help patients track the frequency, duration, and severity of their headaches, as well as associated symptoms and triggers. By keeping a headache diary, patients can provide their healthcare provider with valuable information about their headaches that can help with diagnosis and treatment planning. In addition, the IHS also provides guidelines and recommendations for the use of imaging studies and other diagnostic tests to help diagnose and manage headache disorders. Overall, the IHS diagnostic tools and guidelines play an important role in improving the accuracy and consistency of diagnosis and treatment for individuals with headache disorders. 4. Other diagnostic tools that may be used to diagnose headache disorders include neurological exams, imaging studies such as MRI or CT scans, and blood tests to rule out other underlying medical conditions. Neurological exams, which may include tests of reflexes, strength, sensation, and coordination, can help healthcare providers identify any underlying neurological issues that may be contributing to the patient's headaches. Imaging studies such as MRI or CT scans may also be used to help diagnose headache disorders, particularly when other neurological symptoms are present. These tests can provide detailed images of the brain and surrounding structures, which can help identify any abnormalities that may be causing the patient's headaches. Blood tests may also be used to rule out other underlying medical conditions that may be contributing to the patient's headaches, such as infections or autoimmune disorders. Overall, the use of multiple diagnostic tools and criteria can help healthcare providers make accurate diagnoses and develop effective treatment plans for individuals with headache disorders. 5. It's important to note that some headache disorders, such as migraines, may be underdiagnosed, as patients may not seek medical attention for their symptoms. This can lead to underdiagnosis and undertreatment of these conditions, which can significantly impact the patient's quality of life. There are many reasons why individuals may not seek medical attention for their headaches, such as a belief that their symptoms are not severe enough to warrant medical attention, a lack of awareness about available treatments, or a fear of being stigmatized or dismissed by healthcare providers. To address this issue, it's important for healthcare providers to raise awareness about headache disorders and the importance of seeking medical attention for persistent or severe symptoms. This includes providing education about available treatments, addressing any misconceptions or fears patients may have, and ensuring that patients feel heard and supported in their healthcare journey. By improving awareness and access to care, healthcare providers can help ensure that individuals with headache disorders receive the appropriate diagnosis and treatment they need to manage their symptoms and improve their quality of life. 6. Headache disorders can have a significant impact on quality of life, so accurate diagnosis and treatment is essential for managing these conditions effectively. These conditions can be debilitating, leading to pain, fatigue, and other symptoms that can significantly affect an individual's physical, emotional, and mental well-being. Accurate diagnosis and treatment are essential for managing headache disorders effectively and improving the patient's quality of life. With a proper diagnosis, healthcare providers can develop personalized treatment plans that address the specific type and severity of the patient's headaches, as well as any underlying medical conditions or triggers that may be contributing to their symptoms. Treatment options for headache disorders may include medication, lifestyle changes, and alternative therapies such as acupuncture or cognitive behavioral therapy. By working closely with their healthcare provider and following their treatment plan, individuals with headache disorders can learn to manage their symptoms and improve their overall quality of life. In conclusion, accurate diagnosis and effective treatment are essential for managing headache disorders and improving the patient's quality of life. It's important for healthcare providers and patients to work together to develop personalized treatment plans that address the patient's specific needs and concerns. By raising awareness about headache disorders and providing access to appropriate care, we can help individuals with these conditions live healthier, more fulfilling lives. 7. Treatment options for headache disorders can vary depending on the type and severity of the headaches, as well as any underlying medical conditions or triggers that may be contributing to the patient's symptoms. In addition to medication, which may include over-the-counter pain relievers, prescription medications, and preventive medications, healthcare providers may also recommend lifestyle changes and behavioral therapies to help manage headache symptoms. Lifestyle changes may include things like establishing a regular sleep schedule, avoiding triggers such as certain foods or environmental factors, staying hydrated, and engaging in regular exercise. By making these changes, patients can help reduce the frequency and severity of their headaches. Behavioral therapies such as biofeedback and relaxation techniques can also be effective for managing headache symptoms. Biofeedback involves using electronic devices to measure and provide feedback on physiological responses, such as muscle tension or heart rate. By learning to control these responses, patients can reduce stress and tension that may be contributing to their headaches. Relaxation techniques, such as deep breathing, meditation, or yoga, can also help reduce stress and promote relaxation, which may help alleviate headache symptoms. Overall, a combination of medication, lifestyle changes, and behavioral therapies can be effective for managing headache disorders and improving the patient's quality of life. It's important for patients to work closely with their healthcare provider to develop a personalized treatment plan that addresses their specific needs and concerns. Patients with headache disorders may benefit from working with a multidisciplinary team of healthcare professionals, including neurologists, pain specialists, and mental health professionals. These specialists can provide specialized expertise and support to help patients manage their symptoms and improve their quality of life. Neurologists are medical doctors who specialize in treating conditions that affect the nervous system, including headaches. They can help diagnose the specific type of headache disorder and develop a personalized treatment plan that may include medication and other therapies. Pain specialists are medical doctors who specialize in the management of pain, including headaches. They can work with patients to develop a comprehensive pain management plan that may include medications, injections, or other treatments to help manage headache symptoms. Mental health professionals, such as psychologists or psychiatrists, can provide support for patients with headache disorders who may also be experiencing mental health conditions such as anxiety or depression. They can provide counseling or other therapies to help patients manage the emotional impact of their condition and improve their overall well-being. By working together as a team, these healthcare professionals can provide comprehensive, coordinated care that addresses all aspects of the patient's condition, including physical, emotional, and mental health needs. This can help patients better manage their symptoms, improve their quality of life, and achieve better overall health outcomes. 9. Regular follow-up with healthcare providers is essential for patients with headache disorders to monitor the effectiveness of their treatment and make any necessary adjustments. Patients should work closely with their healthcare team to develop a personalized treatment plan and establish a schedule for follow-up appointments. During follow-up appointments, healthcare providers may review the patient's symptoms and assess the effectiveness of their current treatment plan. They may also discuss any side effects or concerns the patient may have and make any necessary adjustments to the treatment plan. It's important for patients to attend all scheduled appointments and communicate openly with their healthcare team about their symptoms, concerns, and treatment preferences. By doing so, patients can receive the support and guidance they need to manage their condition effectively and improve their overall quality of life. 10. Diagnostic criteria and tools are essential for identifying individuals with headache disorders, and they are based on scientific evidence and research. The use of standardized diagnostic criteria and tools helps clinicians make accurate and consistent diagnoses, which can help ensure that patients receive the most appropriate and effective treatment. The International Classification of Headache Disorders, ICHD, criteria, developed by the International Headache Society, IHS, are the most widely used diagnostic criteria for headache disorders. These criteria provide a standardized framework for classifying different types of headaches based on specific features, such as the frequency, duration, and location of headaches, as well as associated symptoms and triggers. In addition to the ICHD criteria, healthcare providers may also use a range of tools to aid in the diagnosis of headache disorders, such as questionnaires and headache diaries. These tools can help patients track the frequency and severity of their headaches, as well as any associated symptoms or triggers, which can help clinicians make an accurate diagnosis and develop a personalized treatment plan. Overall, The use of diagnostic criteria and tools is essential for identifying individuals with headache disorders and ensuring that they receive appropriate and effective treatment. By using evidence-based criteria and tools, healthcare providers can make accurate and consistent diagnoses, which can help improve patient outcomes and quality of life. In conclusion, diagnosing and managing headache disorders is a complex process that requires careful attention to detail and a thorough understanding of the patient's symptoms and medical history. By using the latest diagnostic criteria and tools, healthcare providers can make accurate diagnoses and develop personalized treatment plans that address the root causes of the patient's headaches. If you are experiencing recurring or chronic headaches, it's important to seek medical attention and work with a qualified healthcare provider to diagnose and manage your condition. By following their recommendations and making lifestyle changes as needed, you can reduce the frequency and severity of your headaches and improve your overall quality of life. We hope that this video has been informative and helpful in understanding the use of diagnostic criteria and tools in identifying individuals with headache disorders. If you have any questions or comments, please feel free to leave them in the comments section below. Thank you for watching, and we'll see you in the next video.